I think one common theme that you will repeatedly discover is how public scholars manage to weave hope and action from a place of pain and hurt. And I'm saying this because I would like to flag right now the talk that's going to come up very soon, though it is incredibly hopeful and strong, also contains mentions of self-harm. Our next speaker is Logan Burd. Logan is a PhD student at the Interdisciplinary Studies program in UBC Okanagan, and she is a citizen of the Métis Nation of BC. And she's going to tell us the story of working with youth to help prevent suicide.
Okay, hi everyone. So, youth carry so much brilliance and possibility. They shape our families, our communities, and our future. And because youth matters so deeply, their well-being matters too. But we also know that not all young people feel safe, supported, or that they belong. Some are carrying layers of hurt, harm, and disconnection that can make life feel heavy. And when those connections are disrupted by history, by harmful systems, and by isolation, our young people feel that deeply. When we don't talk about these realities openly and with care, young people can feel alone in what they're carrying. In youth suicide risk and prevention efforts, avoiding these conversations keeps us stuck. And it doesn't keep us stuck because we lack concern, but because we are failing to address the full picture. Youth suicide is not simply an individual problem or something wrong with the young person. It is shaped by the environments, relationships, and systems that they are required to navigate every day. And without naming and exploring these broader influences, our prevention strategies remain incomplete. Youth suicide is a significant public health issue, and it impacts all of us. So today, I'm not going to focus on the statistics or numbers because we all know the numbers are high. And every single one of those numbers, data points, represents a person. And that person belongs to a community, has a family, has their own identity, and has a story. So today, I'm going to share about the power of youth-driven research and practice, and more specifically, the power of youth voices and leadership. Tanse, Logan Burd, Nesikasun, Michifnia. So hi everyone, my name is Logan. I'm Métis and a proud citizen of Métis Nation, British Columbia. I'm a PhD candidate, and I'm also the research coordinator for the Clarity Collaborative. But honestly, the roles that mean the most to me are not academic ones. I'm a daughter, a sister, a partner, a friend, a community member, and I'm a youth. And something I think about a lot is that youth is the only one of those identities that I'm eventually going to grow out of, and quite soon. One day soon, I'm just going to stop being a youth. And that has really made me wonder, why do we treat youth like a temporary stage that doesn't hold knowledge? And why do we assume expertise only comes with age and experience? When we look at past suicide research, most of it has focused on what's wrong, risk factors, symptoms, deficits, what's broken, what needs fixing, and often comparing different groups of people. Historically, suicide has been framed as a sin, crime, and what we see today, individual pathology. It's something that's located inside an individual person, and it creates the framing of internalized messaging of, if something is wrong, it must be wrong with you. My doctoral research was inspired by the many circles and spaces I sit in within my nation and communities, exploring how Métis youth's understanding of life promotion can inform upstream youth suicide prevention, as well as the development of equity-oriented indicators to monitor and evaluate youth-defined life promotion efforts. And this will be done through visiting and through finger weaving, which is a traditional practice in our community. It's really no longer looking at what's going wrong, but instead what is going well and what is holding our youth up. We are moving upstream from not only prioritizing clinical-based interventions and instead towards cultivating support, connection, and belonging in our communities. We are moving the research approach upstream from suicide prevention and towards life promotion. We are centering life promotion and wellness, connection to culture, connection to language, connection to community. We are also centering kinship, belonging, and collective care. And these are all protective factors against suicide. Health equity isn't just about making programs and services available to everyone. It's asking, who are these services and programs actually designed for? Whose knowledge counts, and who gets to lead? As a youth in these spaces, I've often been asked to provide feedback or to give guidance on how to bring a Métis youth perspective into different programs. And I would offer pieces of my life, my identity, my family's stories and experiences. But often, I wouldn't hear back from the people who were asking these questions. And I'd be left wondering, what happened to what I shared? How are they honoring it? How are they carrying it forward? And how are they being accountable? Because when we share our stories, we're sharing parts of ourselves. And sometimes I walked away from those situations wishing I hadn't entrusted those parts to people who didn't know how to carry them with care. From the work I've been involved with the Clarity Collaborative, we've heard directly from youth the importance of establishing youth-led governance, creating spaces of belonging and connection, and youth informing what programs and services are needed through sharing their ideas and perspectives. Equity involves youth shaping the questions, designing the services and programs, and telling us what works. It looks like moving away from deficit-based language of how do we prevent youth suicide, and towards strength-based language of how do we support the strengths that youth already carry. Because when young people feel seen, valued, and rooted in who they are, they feel at home. They are no longer just surviving, but thriving. When I envision what health equity in action looks like, I imagine youth voices being prioritized, their ideas being implemented, nurturing connections, and being accountable to the people sharing their stories. I think about youth gathering together, designing research, and teaching all of us. Health equity looks like trusting in youth knowledge. It looks like sharing power and adults and people in positions of power, stepping back so youth can step forward. Youth are innovators, they're imaginative, and they know exactly what kinds of programs, services, and research will actually support them. We have to listen, and listen with the intent to apply actionable steps towards their ideas and goals. If we truly want to prevent youth suicide, we cannot keep designing solutions and research without young people. We need to walk alongside them, learn from them, follow their lead, and provide funding support and capacity building opportunities along the way. Youth aren't just the future generation. They're leaders right now. And that's the future I believe in. And it's one that we can all build together, where youth are co-creators and we all prioritize and promote life collectively. The last thing I want to leave you with is to think about what promotes your life. And what will you do the next time someone shares a part of their story with you? Marcy, thank you.